Okay, let's talk about something that can be just incredibly frightening. That link between chest pain and anxiety. It's a feeling that can literally stop you in your tracks. So let's get into what's actually going on inside our bodies. You know that feeling, that sudden sharp pain that grips your chest and your mind it immediately goes to the worst case scenario. It's a question that sends a jolt of pure fear through anyone, and for a very good reason. But if this has happened to you, you are so far from alone. Get this, almost 1 in 3 people in the US, we're talking 27.3%, will have a panic attack at some point in their life. This is not some rare thing. It's a really common human experience. And that brings us right here. We've got to start by just acknowledging how unsettling this whole thing is. The fear you feel, it's real, and it is completely valid. Medical sources will tell you that chest pain isn't just some minor side effect of anxiety. For a lot of people, it's the defining feature of their most intense, their worst episodes. That's why this physical symptom is so powerful. It's what makes a panic attack so unbelievably scary. So how on earth can a feeling that starts in your mind cause such a real, strong physical pain in your chest? Well, to figure that out, we have to look at the incredibly powerful connection between our minds and our bodies. And it all comes down to this one thing, the fight or flight response. Think of it like your body's ancient hardwired alarm system. When your brain thinks there's a threat, and it doesn't matter if it's a real physical danger or just an anxious thought, it flips a switch to get you ready for action. So here's how it plays out. It starts with some kind of anxious trigger. Your brain senses danger, and then, bam, it floods your system with stress hormones, like adrenaline. That hormone surge makes your heart pound and your chest muscles tighten up like a drum. And that sudden tension, that's what can cause that sharp stabbing pain. It's a direct physical result of something that started as a thought. And this right here brings us to the most critical question in this whole explainer. How do you tell the difference between chest pain from anxiety and pain from a heart attack? Really understanding this is key. Okay, so there are a few key differences to look for. Anxiety pain, it often feels sharp, almost like a stabbing feeling, and it tends to stay right there in the chest. A huge clue is that it frequently happens when you're just sitting around, at rest. Now, heart attack pain is usually described more like a squeezing or a heavy pressure, and this part is vital. That pain often radiates. It travels out from the chest to your jaw, your shoulders, your arms, and it typically happens during physical activity. Knowing the difference is one thing, but what can you actually do about it? Let's move on to some real, practical tools you can use to take back control when anxiety decides to show up. All right, so if you feel an attack coming on, here is your immediate action plan. First, just breathe. Slow, deep breaths send a signal to your nervous system that it's okay, you can calm down. Second, count to 10. It's so simple, but it grounds you in the right here, right now. Third, get to a safe space. If you're driving, pull over. And last, you have to remind yourself this feeling is temporary. A panic attack feels all-consuming, but the worst of it usually passes within just a few minutes. Now, for the long game, some lifestyle changes can be incredibly effective. Things like regular exercise, actually getting enough sleep, and cutting back on stimulants like caffeine, alcohol, and nicotine. They can all seriously lower your baseline anxiety. And hey, the same goes for foods that are high in refined sugar, because those can cause energy spikes and crashes that really mess with your mood. Okay, we've covered a lot about managing anxiety, but now we have to talk about the most important thing of all, your safety. This next part is absolutely non-negotiable. And let's be perfectly honest, in that moment of intense fear and pain, it can be extremely difficult to figure out what's happening. Trying to diagnose yourself when your health could be on the line is just not the goal here. So, this is it. This is the single most important takeaway from this entire explainer. When in doubt, you do not wait. If you have sudden, severe chest pain, you must seek immediate medical care. It is always, always better to be safe. So let's run through those critical warning signs one more time. Pressure in your chest that lasts more than a couple of minutes, pain that spreads to your arm or your jaw, shortness of breath, and pain that gets progressively worse instead of fading away. If you experience any of these, you need to call for emergency help immediately. So we'll leave you with this question. Look, knowledge is the first step, but it's the action that really matters. Knowing the signs for both your mind and your body is incredibly empowering.
So, what's your plan to take care of your total health starting today?